Now, my dear students, good morning to all of you. I am meeting you for the first time as a speaker for your community medicine topics. Though your batch is a small batch and only 7 people are there, all of you are precious to us because small is always beautiful. And less number of students are there, teachers are more happy because we can communicate to you much better than the larger classes. I hope all these days the faculty members are giving you lectures on different aspects of community medicine, and they're all being used by you for your examination purpose. We would like to have a sort of a monthly test also being conducted. I know that you are getting the weekly tests, and in addition to that, we are planning to have a monthly test where we will include monthly or at least bi-monthly tests where we can include even smaller short notes on the topics covered. So today I am going to discuss with you very important issue of the world, that is the old age problems. Okay, old age is a inevitable problem for each and every one of you. Today you are young, and tomorrow you become middle-aged. After some time you become an aged or old person, and it is going to happen in everybody's life. Now, the point that I would like to drive into your mind is that when it is inevitable that each one of us are going to become old, why not learn certain important lessons from the past, where old people have committed suicide, where old people have got into depressions, and old people lived in a very pathetic situations. I still remember way back in 1993, when I was in Mangalore working as a professor of community medicine. There is one specific home, Little Sisters of Poor, and these people have invited me to give health care to the people of old age home. In fact, by principle, I was not in favor of having a old age home. I told them that old age homes are not the places for the old people. It is as a sort of a last resort, an old man should choose an old age home. The primary responsibility of the old man is the family itself. So they said, sir, we always make it a point to see that they go back to their homes after some time. We bring them here only when there is a sort of an emergency, when this old man is thrown out of the house and he doesn't have enough to eat and he is on the roadside and he is crying for help. Such people, we bring them to the old age homes and rehabilitate them. When they are fit and happy and healthy, we make all out efforts to see that these people are sent back to their families. Okay, so this is the concept you should always remember in your life, in our life. And after accepting their invitation to conduct healthcare services in the old age home, I used to go personally at least once or twice in a month and interact with the inmates of the old age home. Once I met an elderly person aged 70 plus. When I was talking to him, I asked him, what is your problem? Sir, I don't have any physical problem. And I'm hale and healthy. I can walk around, I can do all my work, I even help others in doing their work. Then I said, why are you here? Why are you here? When you are so physically fit and mentally fit, and emotional fit, why you should be in a old age home? Then he said, sir, do you know one thing? I was a district collector in Bangalore, and I lived a very great life, and I helped a lot of people. And one day I retired from my services, and then I got my pension from the government. My family members have invited me and greeted me well, and once I was taking a pension and retirement. But after some time, the family members, including my son and also my daughter, they started abusing me. They started showing some sort of apathy. They started insulting me in front of others, and they showed clearly that they don't want me. At that point of time, I realized that the family cannot give me enough emotional support, enough mental support which I require, because I'm healthy and wealthy also. There's no problem of money. I'm getting very good pension. I've got very good savings. And one day I talked to my children, why are you treating me like this? They said, you got lots of money, we don't have money, why don't you give that money to us? Out of sympathy, I gave all my property to my children. Money and other things, and even house property also, I made it in their name. You know what happened? Within 2 months' time, they said the house is sold and all our property is invested. All my whatever property I have given is invested in some business and all these things. So we don't have any house and we don't have property now. So they asked me to get out of the house and said this house is under sale. So they went to a rented house and they started their business. They do not want me at all. So I was wealthy, but at that point of time I felt utterly depressed, because I don't have money at that point of time. I am physically healthy. I was walking about 2 to 3 kilometers every day and trying to help all the poor people and trying to help all the orphanages. I was doing a lot of good service during that time. I was committed to all that. So suddenly they say that all that money is over, we get lost. So I was virtually thrown out and I was on the streets. These people have called me and they took me to this Little Sisters of Food home, old age home, and they have given enough mental, physical and moral support. Today I am really happy. I'm trying to fight back, and I want to take back all the money that I have given to them. And once I get back my property, I will go back and happily live. So this is the story, a real story. It is not a false, a real story of an old person. This happens in most of the houses nowadays. Now, all the children, they should realize when they were small, young, they are not able to walk, they are not able to eat properly. The parents have helped them to grow up. Imagine when they have thrown their elderly people who are not able to walk or not able to eat or not able to do their work. When they throw them out, they should realize one fact. If they are thrown out at a young age, do you think they would have existed like that? So this simple empathy would help all of you to a good care to the people, to the old people. So this is something which I thought I will get across to you before I start my lecture today. Now the definition. What is the definition of old age? And throughout the world, as per the WHO definition, anybody more than 60 years is called as old person. Of course, there are several differences from country to country. The WHO approved definition is 60 years. And there are some countries where they say 65 years. There are some countries where they 70 years is the limit, right? So this all only to have an administrative convenience. If they make it 60, the proportion of the people who should be cared may be very high, so the government cannot afford to give them all the benefits. To make their task easy and simple, they try to go on increasing the age of the age limit for the old age. So for all practical purposes, please remember 60 years is the limit above which a person will be called as old man or old person. Okay, so if you take this 60 years as the upper limit to get into the old age, we have got about 3 to 5% of the population of this country which is in that age group. 3 or 4 or 5% is very small, but 3% of the 1.8 billion population or 1.4 billion population, that is 140 crores, 5% of 140 crores. That means it comes to around 7 crores of old people in this country alone. It's a very huge number. It is the population of the old people is much bigger than many countries, many European countries. So we have a large number of people who are aging, and on the international side, you can say that in the developed nations, the proportion of the old people goes on up to 22%. Some of the European countries like the Sweden, Denmark, and all these places, where the population of the old people has exceeded 22% of the total population. That means we find in most of the places people who are aged, who are not able to walk properly, who are not able to help themselves properly. This huge population, number of population, requires a special attention so that they can live happily and they can live healthily till their death. Okay, so there are two things in our life. We should be able to live our life fruitfully and positively, happily and easily. It is not the question of how many years you live. It's the question. It is the question of how many years of happy and healthy life you have lived. Okay, so we should not think of adding years to the life, but it is always better to adding life to the years. Adding life to the years. Even at the age of 70 plus, if somebody says, I can go out and bring my own provisions, and I can get whatever I want, and I can visit nearby store, and I can easily help myself. If the person says proudly, probably that is the best statement he can make. So, old age should never be considered as a sort of a curse. Old age should be considered as a sort of a boon from the God. So, when you are old, you have a lot of experience in all the fields, and you have got a lot of stories or a lot of things to tell others, and you are the best person to guide the younger population. For your information, 90% of the politicians belong to old age, and all these people are guiding this country or countries in other countries also. The administrators or the politicians are all the geriatric people. Today, for instance, our Prime Minister Modi has attained 70 years. You can see how fast he goes, how nicely he does every day, and how many programs he conducts every day. You can watch the Doordarshan every day, and how much of activity, how much of energy is there in him. Once I have seen him walking down the aeroplane, the steps, there are about 20 steps. He was walking as though he's aged 16 years. So that itself shows how best he has cared for his own health. Okay. In fact, the concept of aging should be there in our mind as we enter the teenage. From the teenage itself, if we can plan ourselves how we can lead our life in the old age, you will be a better old man rather than a person who has just got into some diabetic problem, who has just got into hypertension, who has just got into the ischemic heart. That time he thinks of caring himself, which is not a correct thing. So the preparation for old age should start as early as the teenage. A person of 19 years, person of 18 years, we should start thinking about the situation that he will have, he should have when he is old. You may ask me, sir, what is this concept you are talking about? Yes, I'll tell you what I mean. I mean that if you are in the teenage, you are at the risk of getting into lots of addictions, alcoholism, smoking, drug addicts, and all these things. Okay, if you can control your urge for all these things, your life will be much better. You drink for about 30 years or 40 years. The whole system, the body system, organs are all damaged, and all these things, they reflect only when once you are 50 plus. All this damage to the nervous system, damage to the other organs by the alcohol, by the smoking, by the drugs, will reflect only when once you are 50 plus. Till that time, the body tries to manage, even though part of your liver is gone, part of your pancreas is gone, part of your lungs are gone, still the body maintains the health till you are 50 plus. And once you are 50 plus, all these things come into forefront, and they make you much more vulnerable for the disease and death. Even at the age of 50, premature death can occur if you are not able to plan your life when once you are in the teenage. So the teenage is the best time when you start thinking about old age, and prepare yourself for the best healthy aging at the teenage itself. Okay, so this is what the message to you from community medicine. Now, the concept nowadays is preventive geriatric. That means you start making certain efforts in the beginning itself, so that you will not get into the problems of most of the old people. So this specialty is called as preventive geriatrics. Now, the first and foremost thing is the social aspects of aging. The social aspects of aging. And many times what happens is, the moment somebody says that you are old, I am 68 plus now, all right? If somebody says, you old man, I get hurt. Okay, and sometimes they say, sir, you are old man, you can't do it. Again, I get hurt. So that means, when once you are old, they start treating you as a sort of a useless or helpless man, and they always say that you are old man, don't do this, don't do that. These are the social problems which we always face, and they are always segregated, isolated, and they are said that, okay, you just keep quiet, you do not have any role here, you can't do that, you can't do this. These are the social aspects that you should always remember, and you should be prepared to see that you can counter this type of behavior from the youngsters. So social aspects are the major issues that we have. The major problem is that you are active for some time, and you have been running the show, and suddenly you realize that you are old, and somebody says that you don't do that, you don't do that, do this. This sort of things hurts you very much. Number two is emotional aspects. Emotional aspects. These people always remember that the old man has got a very low. See, many times old people start crying, just like a child. There's a wonderful poem by Shakespeare. Uh, a man above 60 is a child. A man above 60 is a child. He says, above 60, he starts his life again. That means when he is 61 year old, he lives the life of an infant, right? He has got a sort of emotional disturbance. He is emotionally fragile, and he can always react adversely to each and every type of this. Say, for instance, these emotional aspects can damage you further. Suppose your heart is already is damaged. Emotional aspects can damage your heart further, and they can even precipitate ischemic heart disease due to some sudden bad things things that happen in the family, right? So emotional aspects are also should be taken care of when you are looking into the old age. Financial issues, that is a major issue for all the old people. When he was working, he was earning about 1 lakh or 1.5 lakhs. And when once he is retired, he doesn't have enough to feed himself. Luckily, he may get a pension. There are certain agencies which help you to get some fixed money after you retire. But still, the financial issues will continue, will crop up, and these financial issues can make you vulnerable for many diseases. Now, physical illnesses. See, physical illnesses suddenly crop up, which are not there before, and the moment you are 60 plus, you may have the problem of diabetes. You may have the problem of joint diseases. I am going to discuss about all these things little later. So, physical illnesses are also important aspects of the old age. And metabolic problems, digestive problems, and so many other types of diseases due to metabolic disorders. Because as you grow old, the tissues, they worn out and they don't function normally. They function in a subnormal way, and the metabolism of the body is in a very low level. So these four things you have to remember when you are dealing with the old people. One is they are socially endangered people. They are emotionally weak. They are financially extremely worried, and they have got specular physical problems or illnesses which are incurable. Old age is always called as incurable disease, right? And they have a specific metabolic problems, and they cannot digest as a young man digests, and they cannot eat like a young man. So digestion problems will be there, and other enzymatic and metabolic problems are there. So whenever you are dealing with the old people, you have to think of all these things, and when you are prescribing them for any disease, please keep all these aspects here in your mind. Whether he will be socially all right after your prescription, emotionally not disturbed, financially not affected, physical illness is not badly endangered, and the metabolic problems should not be increased. So this way, the preventive geriatrics is a specialized subject where you deal with all these aspects in a very detailed manner. There is a specialty known as the gerontology and geriatrics. These are two important specialties that have come up in most of the developed countries. Very big specialties, and they give a lot of money to the practitioners. Geriatrics is the care of the sick people, care of the sick old persons. Whereas gerontology is a study, a science or a specialty which looks into the social, emotional, financial, and physical and metabolic problems of the old man. And gerontology always precedes the geriatrics. That means if the gerontological services are good, there is no need for geriatric services. If the people are given good social life, if they are given good emotional life, they are given good financial support, and they are given good metabolic support, all these things they can give him a better, long, healthy, and happy life. So please remember two terms, that is geriatrics and gerontology. Gerontology is more important than the geriatrics. Now I'll give you a list of health problems which are all peculiar to the old persons. The first one is ocular problems. You know, there is a degeneration of the lens which is leading to cataracts, and some people may get cataract even at the age of 50 plus, and some people may have some difficulty in vision at the age of 50, which they can manage, but later on, after 60, it becomes very difficult for them to manage. So, ocular problems are likely to occur when once you are an old person. In addition to that, the retinal damage can occur due to various diseases. So, retinal problems are the acuity, visual disturbances can occur, but once you are old. Retinal hemorrhages can occur because of the friability of the retina. So, the ocular problems are bound to occur in each and every person's life. Okay, and many times what happens is these old persons, they neglect their cataract problems and suddenly get into other problems due to lack of vision. They may even get into some accidents and other things. So, ocular problems can be easily managed, and when I was around 40 years old or 42 years old, I have come across one patient who has come with cataract, and my ophthalmologist has said that no, your the cataracts are not mature. Till they are mature enough, we cannot operate. That fellow was crying, I am not able to do my routine, but why don't you do it? And then ophthalmologist said, unless it is mature enough, we will not be able to perform the surgery. We went back with a lot of agony, right? Okay, now things have changed. Now people are not asking the old man till it matures. They can even operate. The cataract surgery can be done even at the beginning of the cataract changes. There is no need to suffer for some time before which before the cataract surgery. Now things have changed, and in fact there is an indwelling lens that is inserted, which gives us a very good life. In fact, I have seen a lot of old people jumping after doing the cataract surgery. They say that, sir, I have become again very young. My vision has come back to a stage when I was around 16 years, 20 years, like that. The vision suddenly improves and the quality of life improves, and ocular problems can be easily given solution. So please remember that whenever you are dealing with the old person, don't forget to look at the eyes. Don't forget to ask him about the problems of the vision. Now, acoustic problems. Again, people will have a low ability to hear to the sounds. The ability to hear sounds becomes very critical. Sometimes some people say that we are shouting, this old man is not able to hear, and again the person may not listen to what others are saying, and he may be socially boycotted. When you can't hear, why do you come here? Get lost. So that sort of very bad treatment that is done. It's technically it's called paracusis, and acoustic problems can occur, and it is not mandated that each and every person should get acoustic problems, and they have seen a person aged 87 still having a very good hearing abilities without any hearing aid. And now there are the ENT specialists, they say that we are giving the hearing aids, and the hearing aids is again a major problem because of the maintenance. The hearing aids, if it is kept at a low level, it is not heard. If it is kept at a high level, it gives a resound inside the ear, and it becomes very difficult for the old man to manage the hearing problems. So acoustic problems, when once started, even with the hearing aid, they may not be completely solved. They may give some solution, but they may not be completely solved. Then we have the third important health problem known as nutritional deficiencies. A lot of nutritional deficiencies occur during the aging process because of the malabsorption syndromes. These people suffer from malabsorption syndromes, and these people also suffer because they do not get enough amount of food to eat. In most of the middle class or lower middle class people, they don't bother about the old man. They say that why don't you sit at some place, we'll come and give you the food, and they may even be given leftover food. And another problem with the old person is that lack of taste or altered taste. These people cannot relish food because the taste is changed. So because of that lack of taste, they may not eat properly also. So nutritional deficiencies can be because of lack of food, or lack of consumption of the food, or lack of care for those people. And many times what happens is old people forget to eat properly at a given point of time. They may be given some food, and that food is just lying there, and the person is not eating at all. So these nutritional deficiencies occur because of various reasons, and they are bound to occur, right? Most often they are having the problem of vitamin D deficiencies because they are not going out, they are not exposed to sunlight, and similarly they have B complex deficiencies because they are not eating sufficient amount of fruits, and they may have other nutritional problems like protein energy malnutrition, and protein is not being consumed by the people. So all these nutritional problems can occur during old age. Just remember about the PM in a child, and PM in a child leads to clinical PM, but whereas in the old man, it doesn't manifest in the clinical words. It only manifests in terms of difficulties and disabilities. Now another problem is a dental problem. These people have got fragile teeth, and suddenly the tooth breaks, and then will be bleeding, and the gums may be infected. There may be periodontal diseases. There may be caries tooth. All these problems can occur to the old man, and it's so difficult for us to manage the dental problems of the elderly. And you ask any old man, including me, are you having good muscular strength? And you say that I have some pain here, some pain there, some pain here, neck problem, some this problem, that problem. So whole body is aching. Okay, and if they walk for some time, their legs start paining. If they do some work with the hands for some time, their hands start paining. So like that, they have a neck problem. When they are sitting for a long time, they may have neck problems. They may have the backaches. All these things are common at this age. So muscular problems are a must for the old man because of the low tonicity of the muscle. Muscles do not have that tonicity. And low tonicity also gives rise to direct inguinal hernias. So that's why the muscular problems should be addressed from time to time by the general practitioners. I don't want to say that all these old back people should be looked after by geriatricians. No need, there was no need. Geriatrics is a general practitioner's domain, right? Apart, the majority of the geriatrics is a general practitioner's domain. Only when there is some complications which requires a specialist, that time only you have to send the old man to the geriatrician. Otherwise, the general practitioners should be able to manage the problems of the old man. Accidents and injuries. Accidents and injuries are extremely common among the old people. Many times what happens is they are on the road and they don't hear the horning of the vehicles. The vehicles will come and hit him and they may die on the roads. And injuries are very common while they are inside the house also. They may hit something, they may hit some wall, or they may hit some steps, and they may fall down and they die because of the distance. There is a old British saying that the old man, they kick the bucket. Old man kicked the bucket. That means the old man died. You know how it has come? Kicking the bucket is equal to dying. You know very well. The old man is actually very inactive during his lifetime, and when once he goes to the bathroom, he has to wash his own body. Okay, that is the only time when he may be doing some sort of exercise. So during that exercise, when he is trying to clean all his body parts, during that exercise, he may suddenly get ischemic heart disease. He may get a heart problems suddenly, and he may die because of that increased exercise at the time of taking bath. So when he is falling, he may kick the bucket and die on the floor and fall onto the floor. Sometimes they may have head injuries, and because of the head injuries, they may die because of the cerebral hemorrhages. So accidents and injuries are common during the old age, and you should be careful about it. Health problems like cardiovascular disease, very common during the childhood, during the old age, like the coronary heart diseases, or the stroke, and all these problems are very common because of the changes in the vasculature, cardiovascular system. Okay, so you should be watchful and careful. Any person aged 40 plus, I'm not talking about person aged 60 plus. Any person aged more than 40 years coming to your clinic, coming to your care services, you have to take the blood pressure of that person. Okay, and don't wait till 60 years. After 40, the problem of the hypertension starts and it increases. So he must have come for some other problem. He must have come for the knee joint problem. But as a general practitioner, you should take the blood pressure of the individual, of that person above 40 years. Don't forget this. This is an important preventive geriatric measure. And most of the old people, they suffer from respiratory illnesses, right? Coughing, sneezing, and the sputum are the common problems of the old age. There is a popular saying that don't teach how to cough to old man. They say Telugulo sagutundi tatak daggu nerputava. Ante pulmonary diseases or respiratory diseases are a common problem during the old age. They may be bronchitis, they may be pneumonitis, there may be a problem of the sinusitis. Sinus problems can also occur during the old age. So you have to, sinus problems leading to pulmonary diseases can occur during the old age. So you should be very careful about it. Then we have spinal disorders. I am not saying that kyphosis and scoliosis can occur. I used to see a lot of old people when I was young. They were totally bent like a comma and walking like in that curved condition. That kyphosis, scoliosis. All these things are common in old age in the past. Nowadays, I am not seeing old people who are 70 plus, even 80 plus also. They are not bending. I don't know the reason. But those days when I was very young, I used to see a lot of old people who are totally bent. And sometimes they are even on the four limbs. They are not in a position to even stand properly. So spinal disorders were common those days. Now also, the people, the more old people come with a very chronic backache, right? So you have to remember these things. Joint problems are very common, especially the problems of the knee joint, right? Osteoarthritis of the knees, both the knees. And I still remember, I've seen one patient who suffered osteoarthritis for more than 10 or 12 years. And then he went on for replacement surgeries. And after the replacement surgery, he started walking like a young man. And he was, his quality of life has suddenly improved. Previously, he was not able to even walk even a very short distance. After the joint surgery, he started walking even 1 or 2 kilometers without any assistance. He used to take care of his children for walking, and after the surgery, definitely his life has changed. So, joint problems are common. The most commonly affected joint is the knee joint, and osteoarthritis can occur, and it may cause a lot of disability for the old man. The environmental issues, like old people cannot afford the environmental changes. Suppose the person is walking in the hot sun, so the old man is likely to get heat stroke much faster than the young man. That means his ability to adjust to the extremes of temperatures is low. So he will not be able to adjust to the extremes of temperatures, and he falls sick when he is exposed to the high temperatures or the low temperatures. So you have to remember these environmental issues and do not subject them for the changes in the environment, temperatures. And almost all the old people suffer from low level of immunity. Their immunological status and immunological system is impaired, and most likely that they will be they will be first victims for any disease that is happening. Even COVID-19, they said that the people above 60 are at high risk of dying because of the low immunity. A disease which is very, very mild disease may become a very violent, very severe disease in the case of old people. That's what happened in Italy. A large number of these old people died when once COVID-19 was spreading across the country. Same thing happened in Spain, same thing happened in Germany, and also in the United States. A lot of old people above 70 died because of a simple COVID infections. So low immunity is a major problem for them, and they should be protected from many infections. The health problems of elderly include complications of the diabetes. Do you think diabetes is a disease? I don't consider diabetes as a disease. Diabetes is an inevitable disorder that occurs in elderly persons. And just like your black hair becomes grey, everyone has to suffer from diabetes at one age or the other. Some people may get it at the age of 40 years, some people may get it at the age of 50, some people may get it at the age of 80 plus. But diabetes is inevitable, it has to occur to the old people. It is it's something which you cannot escape, right? But you can always postpone the onset of diabetes by leading a good life, by leading a good, healthy life. You can postpone it, right? So ultimately, it will strike you. It will strike a person. So when once diabetes occurs, it is again incurable. There is no cure for diabetes. Please remember, you can only give some comfort and a temporary solution for diabetes. And all these people with diabetes, they are under medication and they are being the diabetes is being controlled, and complications can occur in the diabetic patient any point of time. So you should be watchful about the complications of diabetes, and you have to advise all these people. Diabetes is not a disease, I told you. A person with diabetes has come to you, don't tell him you are having a disease. You only say that diabetes is a disorder which can occur to anyone. But the only thing is, if you are trying to change your lifestyle, the complications due to diabetes can be minimized. Similarly, there is a threat of cancer. There are a lot of people who lived up to 100 and there is no cancer at all. But usually as the age goes on, there is a threat of cancer because there is what is known as cancer immunity. Just like there is immunity for the infections, there is a cancer immunity. So all these people, they will be having a reduced immunity towards cancer. So as the age is advancing, they are at high risk of getting cancers. There are a lot of people suffering from neurological disorders and memory disorders and benign prostatic hypertrophy, BPH. And this is emergency. Suddenly, an old man is not able to pass urine. The urinary bladder is so much enlarged that he is in a very, very bad condition. He is crying because of the enlarged urinary bladder. He needs emergency treatment, and he should be taken to the hospital as fast as possible. Benign prostatic hypertrophy usually occurs in people above 60 years. Sexual dysfunctions, again, it's a problem for most of the males. Sexual dysfunction occurs. There is one problem called as elderly abuse. Child abuse you know very well, but similarly there is a elderly abuse, and they go on insulting the old people. They go on ill-treating them. They don't consider them as a human being. They are given very bad treatment. They are not given the respect that they require. So, abuse of the old age. There are some videos I have shown that a daughter-in-law tries to beat the mother-in-law who is a newest person, and he goes on saying, "Why don't you die? Why don't you die? Even after I am beating you, are not dying. Why you are living?" Like that, they talk nonsense. It's the extremely bad things. So whatever that you do to the old man today, it will happen to you tomorrow. Please remember this. Menopausal problems, especially women in the age group of 60 plus, they have these menopausal problems which are unique to them. Urinary incontinence is a problem. Because of urinary incontinence, they may wet their clothing and they start stinking, and people may not be able to tolerate it. And osteoporosis, suddenly they are walking, or suddenly they hit a step or hit the floor, and there may be fractures. Depression and obsessive compulsive disorders are very common in this age group. Lack of vitality. They don't want to live. Every day in the morning they go on crying and they go on worshipping the God. The only thing that they say is, "God, why don't you take me? Why don't you kill me? Why don't you take me out of this life? Okay, please help me." They cry and worship the Father. Similarly, lack of prompt health care. The prompt health care is not given. Recently, in my own flat, I was called to look out to see one sick old man, and the old man was going on telling that he has got chest pain for the past 2 hours. They thought it is something related to the digestion problem. They went on giving food to him, and suddenly he started vomiting. By the time I went, he is already dead. Okay, so when an old man, especially above 60 or above 70, says there is a chest pain, you should always think that it may be a heart problem, and quickly transfer that person to a nearby hospital so that oxygen support is given to him and ventilators can be kept to that fellow and he can be saved. Okay, lack of prompt health care by the health services is a major problem. So let us discuss quickly the social measures, the preventive measures. You got social measures. Where the old age homes are there, I told you very clearly, old age homes are not the solution. They are as a last resort we should put the people, because an old man, even if he is given a VIP treatment in the old age home, he is not happy because he is not with his own children, he is not with his own grandchildren. Health insurance, old people should be mandatorily given health insurance, and nowadays a lot of insurance agencies are protecting the old people. NGOs, they are specially trained NGOs meant for the care of the old people. Pension schemes, all the old people, especially in the lower, in the poor class, they are given pension schemes by the government, state government. Income tax exemptions. When once the income goes down, they have some fixed deposits in the bank, and the banks also give tax exemptions. Income tax. Political commitment. There should be some sort of commitment from the political policies to give some sort of assurance to the old man. And anybody trying to cause damage to the old people should be immediately punished. Now, medical measures include the geriatric care, and there should be at least 1 or 2 specialists in a major hospital who are looking after the geriatric problems. And periodic health checkups, where you are trying to check up the blood pressure, you are trying to check up the blood glucose level, you are trying to check up the joints and all these things. And there is a need to train all our general practitioners to do some care for the old people. And IEC, information and communication systems, should be developed. A lot of videos, a lot of posters should be developed so that the old people can learn from these posters and videos how to go for self-care. Now, primary health care has got an inbuilt system for the old people, and all these primary health care services should be given to them as much as possible. And there should be specialized old age engineering measures, like staircase. My mother-in-law, right? She's around 82 or 83, and she's not able to lift her leg to climb the staircases. So lift system is a must for those people. So staircase, even though it is there, they should have a low-level steps, and they should be in a position to climb the staircases. Similarly, traffic control, when the old man is walking on the road, there should be special care for him to cross the roads. And the walkway should be constructed for the old man. I have seen in Sydney, there are special walkways for the old person, and the old person is cared and given a special treatment in those places. Interior design, the design of the house should be in such a way that there is good visibility, and there is no problem of slippery floors and slippery surfaces where the old people may slip and die. And there should be specific warning signals. Suppose an old man is sleeping inside the bedroom, and he should have some sort of alarm system when he can call the family members. He has got suddenly a heart attack or heart pain. You should be in a position to call them so that a warning signal should be kept up there. Now, finally, one word about the various national health programs which are serving the old people. The first one is the national health care of the elderly, national policy for the health care of the elderly people. So this particular program is meant for the old people, and a lot of inputs are there where they try to train people and also give special healthcare service to the old people. This is a national health program, NPHC. Similarly, A Senior Citizens Act 2007 it clearly indicates all the important measures should be taken for the senior citizens, and senior citizen is given certain legal rights. Suppose a senior citizen writes to the local health, the local administrators that his son or daughter or his grandchildren are ill-treating them, they are immediately booked under the legal procedures. And Indira Gandhi, the Indira Gandhi scheme for the old age, National Old Age Pension Scheme, that's called IGNOAP. Indira Gandhi National Old Age Pension Scheme. This mandates that all the old people who opts for a pension will be given a pension by the government of India, right? They are covered under the pension scheme. A small amount of money is given to these people, at least for their own special needs. Suppose an old man wants some small spectacles to be repaired, right? The son may say that when you are still sitting at home, why do you require spectacles? So we can get it done later. For that small these things, he may object. Is it necessary to repair your spectacles? Like that they may ask. So for those type of things, there is a need to have some pension schemes, especially for the old people. All the old people are not government servants. Only a small proportion are government servants. The government servants, at least, they get a pension scheme till they die, and even after their death, their wives are given the pension money. Like that, they have a very good protecting mechanisms. Like that. So for those people in the sector where there is no government service, there are private sectors. They retire from a good post. They are working in a very big company, and suddenly there is a retirement pension is not given to them. So there is a problem. And there is a specific geriatric care movement which is growing throughout the world, and people are now getting more and more aware of the geriatric care services, and we will hope that all the politicians who also belong to the geriatric age group, they will give more importance for the geriatric care and make all the old people in the world healthy and happy citizens of this world. Please remember, if you ignore them, it is likelihood that you are ignoring yourself. So like that, please remember that treatment of the old people and the care of the old people is our responsibility, and we should not ignore it, and we should give special emphasis for this.